What is the way forward? Way forward is very simple. If Mishra and Mediheal is really culprit, we carry the brush. And if...
Thank you very much. Senior Counsel Katokinian, my name is Gatete Joroge. I work for Citizen TV. I have a number of questions. I have a number of, maybe some of the issues I want Wakili clarifications. I want to know, did the committee visit Mediheal Hospital in Eldoret, number one? You have talked a lot about them not being able to talk to patients and the hospital supplying the documentation. I do believe this committee is formed of health experts and experts in other fields. If then they didn't talk to patients, maybe the information they relied on was from the report, or I don't know if you had a one-on-one encounter with the committee. They came and faced the hospital management together with the lawyers, and you were able to ask all these questions. And now to my questions. I'll start with Dr. Mishra. He talked of patients brought donors, patients who are seeking services brought their own donors. I just want a clarification. Do you mean that all patients, even those from abroad, they traveled with their donors from abroad? Because even Senior Counsel has talked of, there is no non-Kenyan who left this country with a Kenyan kidney. It's important to know that. Also, from the report, 38.94% of recipients have an unknown status, meaning lack of identification documents in the patient record. What is your response to this? Something else, the report shows those with undocumented nationalities are mostly Israelis and Ugandans. You can also give us an answer on that. The report notes that 60 donors failed to reveal their country of origin. Why so? Was it a plan to cover their tracks? That's a question. And also the bit of, maybe the doctor, the nephrologist can help us answer, the bit of one surgeon operating on 24 patients within 14-day period, the issue of workload, and could this have led to the issue of mix-up maybe in the documentation process? I'll leave it at that. Thank you.
Thank you very much. A question from anybody other than somebody from Citizen, please. Are you from Citizen?
Thank you very much. My name is Leon Lidigu from NTV. Leon Lidigu. So let me start with the money. I think I'm very much interested in the money first. Now, to quote the committee, they said that Mediheal charges significantly higher, with the mean bill amounts to 2,313,324 compared to 990,000 at other hospitals, a difference of more than 1 million shillings per case. That is to quote directly from the committee findings. Then they go ahead to say this 100% premium they observe raises questions about cost effectiveness, affordability and accessibility of healthcare for all. Now, respectfully, Wakili Kigen, the price rates for treatments in this country are set by KMPDC. Yes, so did Mediheal go by the rates of KMPDC as the Health Act will dictate? That's the question I want to know. And then $25,000 US for international patients outside Africa, and $34,000 US for overseas patients. Now, the second question comes. The second question comes to the nephrologists at Mediheal. The report states that the nephrologist had practiced there for 8 years and is not a member of the Kenya Renal Association. So I would like the Secretary to explain to us why, and also the issue of expired licenses as per the records, as per the report. On the issue of marketing, there were revealed a market predominance of 72.1. Now, there's also a former Mediheal employee who the committee says they spoke to, who said her work was to recruit patients, and she was using digital platforms, Facebook, she would book Airbnbs for them. So when this is coming from someone who says she used to work at Mediheal who made submissions to the committee. How do you explain that? I would love to know that aspect. Now, on how Mediheal performed donor nephrectomies of nationalities. We see Uganda, we see Uzbekistan. Now, there's this issue of Somali names. I think Kenyans would love clarification on that. I've seen a lot of questions because you find a man from Azerbaijan, for example, is called Ahmed Osman, and another one from Israel is called Hassan Osman. And because they have common surnames but different nationalities, it will be interesting to know how these are related, considering Mediheal submitted that each person used to come with their donor. Yes? Now, just a question to Dr. Mishra. You've passionately put up a case on how the journey you've come from with Mediheal and everything, and how you're changing the lives, you've been changing the lives of Kenyans. I would want you to tell us from a personal aspect, because everyone is saying everything, and this is coming from the government, not even the media. Yeah? Did you, or have you really been engaging? I want you to talk to us like a human being and explain to us, what does this mean for you moving forward? Where do you go from here? I really would love to know that from that perspective. And finally, now, the committee also accuses KMPDC of a possible collusion. And of course, if the report is accusing KMPDC of collusion, they were not colluding with themselves. It means that they are building a string between KMPDC and Mediheal. So I would love to find out from Wakili Kigen, is it also true? Thank you.
Thank you very much. Any other question? And yes, sorry, any other question? Okay.
Thank you very much. I will give you first I address to Mr. Gatete Joroge from Citizen TV that the different sources of donors. As I said, Kenya doesn't have, first I will refer this sentence to you. Kenya doesn't have our law and rule for tissue transplant. As you know, not only kidney can be transplanted, heart can be transplanted, heart, lungs, liver, cornea, and kidney. And also blood transfusion is a foreign thing to donate and transfuse from one person to another. So the law and rule are on the way coming to guide. So we don't have a law and rule and guideline to refer. But as we know that there are two types of donors. One is relatives. There are two types again, relatives, blood relative, non-blood relative. Your wife can donate, but she's not blood relation. And or in-laws, to that matter. Then another is your friends, Keith and Keith, friends, known, and also from humanitarian ground donors. These donors, as I said the foreign donors, that is two types, African and non-African. Non-African are from Asia and Europe. They came with their donors. And we just do the affidavit that no money and transaction or commercialization is involved, and with this affidavit and legal consent has been done. Number two, the donors from other African countries apart from Kenya, all of them, they came from their respective country. Not a single Ugandan has taken Kenyan donor, or not a Burundian, not a South Sudanese. They have brought their own donors. Number 3, Kenyan passport. Whether their patient is from Western, they brought donor from Eastern, or the patient from Western brought donor from Western, the patient from Northeastern brought donor from Rift Valley, or Rift Valley to Rift Valley. So it is that type of, they are also relatives, they are also non-relatives. So waiting for the new law and rule will come and will be guided accordingly. So that is your answer, Mr. Zorori. That is. Now, you have another question to me, that 38.4% patients, can you repeat that question, Mr. Gatet?
From the report, 38.94% of recipients have an unknown status, meaning lack of identification documents in the patient record.
No. See, as I said our attorney said, and I also said, all the affidavits, records are given to Kenya Medical Dentist Board Council and the second week of May or third week of May, I don't remember the exact date. So they have also received, and we have the hard copy, original, and we can provide you, if you can get a court order for Data Protection Act, then we can give you all the data. So no problem there. We have all 100% data. Any question to me, Mr. Gatik? Now, Mr. Leon, thank you very much. Your question to me, I will give you 2, 3. One is, first you said as a human, the person, what we started, what is the way forward? Way forward is very simple. If Mishra and Mediheal is really culprit, we carry the brush. And if we are innocent, in the name of God, please give us justice, we'll carry 1,000 times better and bigger and stronger with passion. Mediheal doesn't belong to Mishra. Mediheal belongs to Africa and Africans. And it will go all over Africa. Thank you very much. Any question to Mishra? Again? Mr. Leo, thank you.
Thank you very much. I think, as and you know, we also don't want to keep you here too long. As I understand, there will be other engagements. But on the issue of the kidney transplants, they are all very well planned. There is a plan of, so there is no overworking. All the surgeries have been properly planned in a manner that is cost efficient. I think, Mr. Leon, you asked the question on the issue of the price. I would really have been very happy if also there will have been actual reporting from the Kenyan media of how much Aga Khan is charging, how much Nairobi Hospital is charging, how much Nairobi West is charging, how much Mishra is charging. Because indeed, if they are actually charging 1 million shillings, there probably will be no need for anybody of us to go to India for treatment. What we know as available information, which again, I really want to say, either the committee was lazy and incompetent, or they were outrightly biased. Because the information available, which we ask you also to corroborate, is that Aga Khan is charging 3 million to 3.5 million shillings. Nairobi West, 3 million and above. Mishra, more than 3 million shillings. Mediheal, 2 million shillings. Nairobi Hospital, 3 million shillings. But this is not from me. This is something that you can also go out and confirm. So, indeed, if there is one thing that can vindicate Mediheal, is basically by that pure one erroneous fact that is a major falsehood. We do not want to interrogate. We want you as a media to also just go and find out how much is being charged. of the top 5 hospitals providing kidney transplant, we are convinced that the most cost-effective one is Mediheal at 2 million shillings for Kenyans. Yeah.
I'm sorry to interrupt. My question was, the Kenya Medical and Disease Practitioners Council has a structure in terms of what procedure and how much it should be charged. So my question was, did Mediheal follow the structure as per KPDC? I don't care about what other people are doing, yes, because here it's Mediheal that's on the chopping block. Yes. So I'm just trying to establish if Mediheal followed the price as instructed.
I'll answer that. First, Mr. Joroge Gatete, there is no way Mediheal has done 24 cases in Mediheal hospital continuously. There is no figures and facts are there. The theaters record and everywhere you can have access. We have done maximum 18-17 cases in the span of 1 month. You understand? And so there are 2 types of Mediheal. Mediheal who is working well before 23rd, 2023, April, and after 2023, the disaster and destruction. Are you getting me? So that is not correct. You understand that? And we never, sometimes 20% of times it was done more than 1 case, that is 2, and 80% time 1 case in a day. Thank you. Now, Mr. Leon from Nation. Now, you said 900,000 ceiling. That is for the public sector, not private sector. Please, kindly refer your more insight there. 900,000, why? Because the public sector, there is a special arrangement of Kenyatta National Hospital, OETC Referral Hospital, and so on and so forth. They get money, the rest money from the taxation which is special arrangement for. I was also part of, once upon a time I was in Moi University, head of the Department of Reproductive Health, and also Moi Referral Hospital, Moi teaching. So I know that. That is not for private sector, sir. In private sector, you can go and do your arrangement in 1 hour. You will find all the rates. Am I correct, sir? Then your question was Kenya Medical Practitioners Council has a guideline. You see, there is no guideline for package. The guideline comes is in every procedure. Suppose surgical procedure, I'm going there. Either it's kidney transplant or open heart surgery or hip replacement or whatever. There is a statutory range. There is no fixed. There is a range for the consultant surgeon, for the consultant anesthesiologist, or consultant pre-operative physician, or post-operative follow-up. There is a range for the theatre fees. There is a range for the ICU fees per day. There is a range for physiotherapy, laboratory, pharmacy in a different way. If you calculate that range, we are far less than above level. Thank you very much.